Welcome everyone to this exciting fireside chat session. I'm really excited to have our guests here today. I'm Kat Garbus. I'm part of the Jamf team. I'm a senior channel program manager, and I also moonlight as our podcast host. So I am here hosting this exciting session today. And before I introduce you to our very important guests, I wanted to just kind of acknowledge healthcare. That is the topic of today, healthcare and technology, but more specifically, healthcare and Apple. We all know, especially many of you listening in, healthcare is a highly regulated industry. There's a lot of moving parts. There's so many softwares, especially when it comes to legal things like with the law and HIPAA compliances, along with even just making everything work. It can be challenging, dare I say, intimidating. And we wanted to bring in some very special guests that have done this. And they've tackled the question of how does Apple work in the healthcare space? And not just work like, the Cinderella stepsisters trying to make a shoe fit that didn't quite fit their feet. We're trying to say, how do we make it work for your organization? Can this be done again and again? Was this team just lucky? And the answer is no. They found ways to make healthcare work. I like to keep things simple. It's very much rinse, lather, repeat is what I think you'll find today. So if you're sitting there thinking, hey, I'm in healthcare, Apple devices are being asked or they're showing up, we need to wrangle things in, how do we make things work? We really hope today will be super educational for you and helpful. And what better than our team of experts? So without further ado, it is my honor to introduce Tim Hassett and Scott Smiser. Scott, if you don't mind, can you kick us off with introducing yourself and kind of who you are, and then we'll turn it over to Tim.
Yeah, absolutely. Thanks, Kat. So good afternoon, everyone. Scott Smiser. So I've been in the industry for 34 years. Ironically, I started out right out of high school in a hospital, and I thought I wanted to be an anesthesiologist, and I thought that would be a good way to get into medical school. 34 years later, I stayed in business in healthcare informatics and healthcare technology. So pleasure to be here, and hopefully we get everyone excited about what Apple is doing with healthcare.
Yeah, thanks, Kat. Thanks, Scott. Yeah, so my name is Tim Hassett. I'm CEO and founder of Appogee. I'm right behind Scott in that I've been in the Apple enterprise space for about 26 years. So trying to get caught up to him, but real quick on who I am and who Appogee is. I'll start with Appogee. We're a very unique Apple channel partner. We're an Apple premium business partner. And what's so unique about us is that we're solely focused on doing Apple well and in a great way and at scale in the medium to large enterprise. So part of that is we have a big part of Apogee's business that's where we operate really in a lot of Apple's named healthcare accounts, the medium to large hospital systems. And so we have a good amount of experience over 10 years of iPhones being put in nurses' hands, and then newer things around the iPad and the Mac and the other things we're going to talk about today. So, but early on in my career, it was really the legacy Apple enterprise space, so publishing, advertising, those things, and it's really grown to where, along with Apple, to where they are today. So excited to be here, and just so proud of the work that our team has also done in healthcare. So thank you, Kat.
Yeah, of course. Thank you both for being here. Scott, you're coming to us as the healthcare industry expert. So those listening in, they might have been in your shoes before, where they are in charge of a deployment. They've been in charge of technology. So I want to start big picture and kind of tap into your experience, especially over the last few years, because Apple in healthcare, in the scheme of things compared to Windows, is relatively new. So let's start big picture. Apple hospital effort. What was that? What does that mean? Can you help unpack that for our listeners today?
No, it's a good question. So, to me, when I refer to an Apple hospital, I think it's really getting into how do you leverage Apple products and their ecosystem in a larger way than typical organizations are today. I think you'll find, the mobile aspect of tablets and phones out there in hospitals. But to me, what Apple Hospital really culminates as, we can do one-to-one, where we can deploy devices to an individual user or clinician. We've done one-to-many, where we've done a whole department, a nursing unit. And really, the Apple Hospital concept, or bringing it across the enterprise, is one-to-all, that all users are using Apple products out of their ecosystem in a healthcare setting.
Got it. And When we think of that, right? I mean, Apple is sometimes part of a greater infrastructure, but Apple makes a lot of different products. So does this basically mean bringing most of their major products into a hospital? What technology was brought in to the hospitals you've supported in your tenure?
Yeah. So I had the honor of actually working for a health system that we were the first to bring Epic locally and natively to a MacBook. So Epic is the major player in the EMR space in the industry. They actually wrote a version of the product that runs natively as an app. It's in the App Store. And I was able to roll that out at scale with my team. So that's where it really started to change the narrative of like, okay, we can use devices that have healthcare grade systems on it. But that's when it really started rolling, is with the MacBook Air and Epic locally.
What were you hoping to achieve? Like, did you wake up one day and say, let's just bring a bunch of Apple technology in and like what motivated this and what were you hoping to achieve in doing so?
Yeah, for me, I was fortunate that I had executives above me and around me that were excited about doing this as well. So that was first and foremost. But I think, what we were trying to do is move the narrative on user experience. 70% of college graduates that get into healthcare, they've used Apple products most of their lives, and they get into healthcare and they're like, okay, forget about what that means as far as an experience to you, but actually start using this Windows device and use these Windows applications. And it was really the first time that you were able to do something for people instead of to people from a technology standpoint.
I love that. It sounds like, and before, Tim, I've got some questions for you, but before I move on to you, Tim, Scott, I just want to press on something. So you had executive sponsorship. What would you say to anyone listening right now that may not have executives that are like, yeah, let's test out Apple, let's bring it in? Like, what would you say to someone where there might be some internal conflict they're facing of some of us want Apple, some of us don't, some of us are concerned of Apple? Like, talk to us a little bit about that, because not everyone's as lucky as you, where people are like, yep, let's bring in Apple.
Yeah, no, I mean, you have to have support from the top down. So I think a lot of misconceptions that are out there, and as a consultant, I mean, I've used a MacBook for 20 something years, and I've been out in organizations where literally the organization, and this has been a number of years, they're like, you cannot put that on our network, you cannot connect to our Wi-Fi, we don't support these devices. And it always threw me that I was like, I'm using a device that I really enjoy using, but there was this stigma. So I think you've got to have support from the top down, but I think the misconceptions out there, well, Apple's twice as expensive as these other devices. And when you really break the numbers down, especially when you look at the footprint of the MacBook Air and the M4 chips, hopefully soon to be M5 chips, that price point is, I think, $999 for an entry-level device. And that is more than powerful with 16 gigs of RAM to run office functions, to run an EMR, et cetera. When I would look at purchasing a Windows grade device for a business deployment, I can't touch business grade Windows laptops for $999 with everything included. So that's the biggest misconception I think a lot of organizations that I've talked to run into, is that, well, this is going to be twice as much and it's more complicated to run and we can't do that. But you don't realize it's not as bad as people think technically, and it's certainly financially that there's a lot of benefit in using Apple products, in my opinion.
And in my experience too, there's financing options available, there's buyback programs as well, there's recycle trade-in programs. So there's lots of different ways to get creative with budget and things like that. Tim, I want to turn it to you. So looking at Apple's products in hospitals, which are more established, would you say, and more mature in the healthcare setting, and which would you find are newer?
Sure. Yeah, good question. Yeah, Kat, I'd say, our hospital system relationships go back at least 12 years. And so I would say in the early days, to Scott's point, those early day deployments were mainly around putting iPhones in the nurses' hands, primarily at Epic sites that were running the Epic EHR for Epic Rover and for clinical communications and alarms and texting and alerts. So that goes all the way back to, gosh, I remember the iPhone 6 and 6S. We had some systems saying, okay, we tested this. We now want to buy thousands of these and put these in the hands of our nurses. So I'd say if you think about Apple and healthcare, the more mature space is that. And what I would say is what's evolving there is in those early days, a lot of those iPhones were shared. So there'd be a bank of phones that a nurse would pick up one and then deliver care throughout their day. And what's maturing there is there are a lot of systems that are now doing one-to-one issued iPhones. So I'd say that's a little bit more mature, the iPhone. And then what's a little newer are some of the things that Scott's talked about, where the Mac is definitely newer, and the catalyst there has been the Epic Hyperspace app running on the Mac. That's opened doors for a lot of folks that really just are happier users when you can put a Mac in their hands. So that's new. Some of the things that we're seeing with the Apple Watch and iPad, if we think about just the main big Apple products, those are the newer things. iPad was probably a fast follow to the iPhone. For Epic, MyChart, and Bedside. But those iPad use cases have evolved and modernized as well. So that's what I would say. iPhone pretty established, iPad a little bit behind it, and then the Mac is a lot of forward-thinking, innovative healthcare leaders like Scott are saying, hey, let's serve our users well, and then let's take care of the caregivers that take care of the patients by giving them the ability to choose.
I think it's maybe fair to say for anyone listening in to just kind of round that out that, iOS has been around the longest, but Mac is here too, and both can be achieved regardless. I think maybe that's a fair way to say it. That's great.
Sure.
I want to kind of wrap this up a little and bring this home. So Scott, we touched on this a little bit ago, but to anyone listening in that they're like, hey, we're considering Apple or we have some Apple, what would you say if you're like, have some steps of how to get this going so they can be successful too? We touched on executive sponsors, like getting that buy-in and convincing them is important. You touched a little bit on the hardware budget piece. What else comes to mind?
I think the biggest thing is it's just the mechanisms to deploy devices at scale. Organizations have those today, and there's things that you'd have to do to deploy Apple at scale, but you've already got the mechanisms and the people and the teams to deploy devices across a large enterprise. You just got to make sure that the security posture on the device and the profiling of the device is congruent with what you want from a security standpoint. But I think the biggest thing is getting stakeholder buy-in to what you're trying to do. I've always been one, as a CTO, I've said, I'm not going to do technology for technology's sake. And, again, I think that the mantra of this is doing something for clinicians instead of to clinicians is the biggest thing. But I think having your informatics teams involved in use cases of how the products work and how they're going to be interacting with the device. But I can tell you firsthand, seeing the reaction of users that are using these devices in a clinical setting, I can just see it in them, that they're excited about what they're using. I had a story where an Apple nursing unit where a travel nurse went onto that unit, and I was told by administration that she had made the decision to go off the road and go work for that hospital, but she wanted to work on that unit that had all the iMacs and Epic on it. So to me, that's a differentiator, in clinical satisfaction, relieving clinical burden. But I can tell you from my vantage point, the way they feel about interacting with these devices, it has to translate into patient care. I just know it has to, because they're using a device that they feel good about. And I feel like that is going to be the spirit through which they're delivering care in these facilities.
I like where this is going, and maybe to help our listeners as well. So you touched on like patient care. So maybe we could say that's like the outcome, right? Like what goals? Like someone could say, hey, we like Apple, we would love some Apple, that's nice. But what were maybe some of the outcomes you wanted? Like, okay, we're going to include Apple. What are the goals, or what do we want to have that positive impact? What outcomes and things are we hoping to get by including Apple in this ecosystem?
Yeah, I think first and foremost, it's just trying to relieve clinical burden from them. I firsthand have seen, iMacs on carts where you interact with a nurse and he or she doesn't really know the technology that goes into that cart per se. But the two things I would hear over and over again from clinicians when we would round is, I love the display of this device. I'm like, tell me more. And they're like, it's just so easy on my eyes, the font and the color, it's crisp, it's quick. So, that's the 4K Retina display coming into play, right, on an iMac. And, then they would look at each other and they would start asking like, well, when's the last time you charged the cart? And they're like, oh, I don't think I've charged that one this shift. Because of the silicone chip, it's using 50% less energy. So what they're finding is those carts are not having to be charged every shift, that you're seeing carts go almost a full 24 hours or longer without being charged. So by doing Apple products in that way, I feel like we were relieving burden from the clinician to worry about, am I at 12% battery? I need to plug in. I can't use the cart mobility wise. And again, it's like deploying a device that they feel good about using, they like using, they love using. I've seen situations where in early deployments, nurses and doctors were writing with Post-it notes. It didn't look very aesthetically pleasing, but they would put like, this is Scott's Mac from 2 to 4 this afternoon, or this is Susie's Mac from 11 to 1. So they were putting Post-it notes on the device, reserving it to do their work and documentation. So to me, that spoke to just user experience from the beginning.
There's a few things you're hitting on there. Yeah, ease of use, user experience. I mean, the last thing someone wants to worry about is this charged while they're trying to help somebody, whether that's a really critical situation or not. Like that's the last thing someone wants to be dealing with. So I think you hit on some really, really good things. Tim, I want to have you chime in a little bit too on this next question. What are some of the initial objections when it came to Apple in general, and how were they overcome? Were there any pilots done? Was there any tests done? I would love to hear, like, if someone was like, it sounds like there was mostly executive buy-in, but this could be helpful for someone who doesn't have any executive buy-in at this moment, and people might be at a standstill. But what initial objections were there to Apple in general, and how did we overcome that?
I think the biggest objections, and we already talked about that, is just the perception that it's twice as much or it's just more expensive, and that has to be dispelled quickly. The other thing is just from the standpoint of, these are more than consumer grade devices. I think there's a perception in some industries, it's like, why would you use Apple? That's a consumer grade device. It's not a business grade device. And that is so wrong that people have pigeonholed Apple products into consumer, or if it's in your organization, oh yeah, that's what the marketing and the publishing people use. They don't use anywhere else in the business. So I think the cost and just perception that it's more than a consumer device.
Tim, how about you in your experience? What would you say?
Yeah, Kat, I sometimes call them superstitions. The cost one is a big one. Scott, Scott's hitting the nail on the head there. I think also, and these are some of the areas where Apogee serves, is operations and management of the device. Some folks that don't have a lot of Macs are like, oh my goodness, how do I manage these? Can I manage them? Will they be SOC 2 compliant? Will they meet all of our security requirements? I think there's a little bit of paralysis around, well, hey, how do I make the Mac a citizen on my network like a Windows machine? Yeah. And so I think that's superstition number 2, that may be hard or require a lot of jujitsu to get done. And I think some of the other superstitions are around just how do you operationalize that? How do I deploy these at scale? How do I support them at scale? Help desk, user tickets, all of those things. How do I make this part of my operation? So in a lot of, one of the things that I like to say is it's easier than it's ever been to make the Mac a first-class citizen in a highly regulated, complex environment. That's number 1. Number 2, there are a lot of peers that have already done this, and they did this years ago. So you have folks like IBM that have like over 130,000 Macs. You have large global banks that have tens of thousands of Macs. Like this was done years ago, so it's somewhat mature, somewhat established. It's not even like bleeding or leading edge. Like, hey, we're in the middle of the bell curve now. Like it's easy to get these deployed. Now you do have to be thoughtful around working with your engineering team and your device management team and just building all of that out. But it's easier than it's ever been, and it gives you a lot of upside on once you do it in terms of risk mitigation and user satisfaction and just being a place where people want to work. There's an executive that says that the device you're putting in your users' hands is not trivial. It is core to what they're doing every day. They're picking it up 8 hours a day or longer and looking at it. It's not trivial. So those are some of the superstitions and some of our answers to those, if that helps there, Kat.
That helps with a lot of those challenges. And I think it's a good segue into like focusing on the Mac itself, because we've talked a little bit about Apple and healthcare at a high level, some of the challenges and things, but I want to zoom in a little bit on the big picture with Mac. Scott, I believe you mentioned early on that you are personally a Mac user, if that's correct. Yeah.
I am, for over 25 years.
There you go. And then, but that doesn't always translate right into the workplace. A lot of people use Apple personally at home, but that doesn't mean they get to use a Mac at work either. So oftentimes in my experience, we've seen the Mac compared to Windows or Chromebooks. What have, like, kind of why the Mac instead of a Windows or Chromebook? What results were you hoping for in all of this?
Outside of just basic user satisfaction and people wanting to use the device and have the device, lowering the total cost of ownership. And, a lot of that will play out in the years to come. But, there's been Forrester researchers and different researchers that have shown that, that these devices in healthcare in particular, or in any industry, will require less support help desk tickets. So there's less issues with them. As a CTO, I felt like, okay, that device doesn't need to be recycled every 3 years. I could probably get more out of it if I wanted to. But then I also have that creative things with Apple that they will buy the device back at a pre-negotiated rate at the beginning of it, so that you're refreshing the device every 3, 4, 5 years, however long you want to do it. But I think that the biggest thing is just lowering the total cost of ownership in addition to the user experience. Because everything is built in. There's no OS upgrades. There's no extra software that I have to buy on that device.
Yeah, absolutely. I would say you mentioned the Forrester study. That's a really great study to follow. We have a study as well that feeds into TCO from Hobson and Company. That's a little more focused on Jamf, but nonetheless, I think it plays a role into the total cost of ownership. So for any of our listeners that want to take a peek at some statistics, those are really great studies. And then we even have ROI calculators available too that I think could be helpful when we're trying to demystify costs and budgets and things like that. Any superstitions around the Mac itself that needed to be busted by any chance? And Tim, feel free to chime in here too.
Oh, I would say, aside from a lot of things we talked about, when, there was a deployment that we worked on with Scott where at that particular time, CrowdStrike entered the picture. So I would say the other superstition, and I touched on it, is while the Mac is a different platform and hey, we've got to support it and all of those things, those aren't, it's easier to do that now. The upside you get in terms of risk mitigation and having a resilient company, a resilient network of endpoints is a big upside. And so I think the other thing I would call out would be around CrowdStrike. And Scott, you were like literal boots on the ground when that happened. And we were able to observe, hey, these Macs are up and running while the Windows machines are blue screens and need to be addressed. Scott, you may have some more specific stories around that. Love to hear your thought on the security piece.
Well, and as a CTO in an organization, that was a wake-up call for me, because in that moment when CrowdStrike happened, I had 32,000 devices that went offline. And, the back-end systems were up, the data centers were up, but nobody could get to them. And I saw firsthand where iMacs and Macs, in particular, MacBooks, were logging into Epic. They were making their way into an ER to support patient care. They were making their way into surgical cases to support patient care, into clinics, et cetera. So in that moment, I thought, okay, the mitigation that you're spreading the risk that hopefully both operating systems wouldn't be attacked or have an event like that at the same time, that you're not totally dead in the water, that you've got a footprint of your device fleet that was still up and running. And the funny story in that situation was, it wasn't funny at the time because we were all trying to get the blue screens fixed and get everything back online over the weekend. But the nursing unit that I spoke of, the ICU was across the hall, and the ICU nurses said, "Why are their computers all working?" Because that nursing unit, they didn't skip a beat. They were like, "What is this blue screen thing everybody's talking about in the cafeteria?" But they were all Mac. right? They were all iMacs and MacBook Airs. And so literally they found themselves loaning out their carts that had iMacs to other units for critical care because they were working in that moment of crisis. So I think to me that, put all user experience, total cost of ownership aside, what we're here for is for patient care and delivering quality outcomes in any health system in the US, right? And I just felt like those devices in that moment showed that, we were able to limp along as we brought the rest of the organization back up.
I love that. So I want a few things I want to just kind of spell out maybe and from my interpretation, kind of hearing this story. So the big CrowdStrike event that happened, everyone got their blue screens. I was on vacation that week, so I was just seeing it on my phone. I was like, oh, I picked a great week to be off work. But as you said, many of you were kind of working through the weekend trying to get things up and running. And that was like, at the end of the day, like that was a really big incident. Like it impacted a lot of organizations. And I love that for a few reasons. Because one, a lot of people don't think about risk management in the sense of having multiple OSs and platforms out there. And it makes sense. Like, if you had like $10,000 and you were going to go buy some stocks, would you spend all of that $10,000 on one stock? You wouldn't put your eggs all in one basket. You would want to mitigate that risk and get a few different stocks in, healthcare, finance, technology, right? You want to like kind of spread that risk. That way, hey, if you do one stock's doing great, but if one stock plummets, you still have, money left over and it's spread elsewhere. So I love that because I don't think that's come up in a lot of conversations as a risk management way to have multiple platforms, and that Mac can help with mitigating risk. What an interesting takeaway. I'd be curious too, because we've talked a lot about like Mac, iOS, but I'd be curious as to like, why Jamf? There's so many different other solutions out there that people could theoretically use that are cross-platform, so I'd be interested in kind of hearing your perspectives, both Tim and Scott, on why Jamf was selected to be the backbone for managing and securing the hospital settings that you've both worked in the past and previous projects that you've supported.
Yeah, Scott, you made the decision, so I'll let you kick off and then I'll follow.
I didn't make the decision alone. I mean, I had a great team that was doing all the analysis on vendor selection. But I mean, Kat, the reason why, we went with Jamf is that when you do a comparative, Intune and Microsoft have a great product for managing devices. And, there was a couple of blind spots that concerned me. And the blind spots were, how deep are we going into the Apple ecosystem, meaning all of their OS flavors? And when you get into tvOS and watchOS, those are two that stuck out that Intune at that time wasn't able to address those devices. So those blind spots, if you're going to go all in Apple's ecosystem and all devices, there's some blind spots there that you can't manage certain devices. The other thing that really stuck out for me was when the team was talking about Healthcare Listener with Jamf, and the fact, the bedside tablets would receive a copy of the ADT coming off the interface engine, and it would reformat the device as soon as the patient was admitted to that room. And conversely, would reformat and erase the device when they're discharged from that room. So that in of itself, and the first time I was able to watch that, I was actually in a patient simulated room, and they admitted them in Epic, and I saw the process of how I got profiled, and then they discharged them in Epic, and sure enough, the Apple logo popped up, it said reformatting, and it came back online as the next patient. So those were the things that really tipped the decision point for me in the last organization.
Yeah, I would say, in addition to everything that you said, when we look at macOS device management in complex enterprise environments, Jamf, in our opinion, is still the gold standard. Its ability to respond quickly to any sort of enterprise need, to be able to immediately push changes or updates to devices, and deal with things like federated identity and platform single sign-on and zero trust network access and all of these things. Jamf, in these environments, our go-to is Jamf. So And then all the cool things like the healthcare listener, how to handle shared devices, tvOS, watchOS, everything that Scott talked about. We actually worked with Apogee's pro services engineers to not only just do a grid analysis in Microsoft Excel about 4 to 5 major MDMs and everything they can and can't do, but we also wrote about a 7-page white paper for the project that Scott and I worked on, which was an SBAR, a situational analysis and recommendation. Hey, you could get this done with a number of different MDMs, but here are the pitfalls. Here's where you're going to need to throw extra engineering labor at things, or you can choose Jamf and it'll require a little less engineering labor and complexity and hoops to jump through. So that's what I would say would be the answer to why Jamf in this situation and a lot of other ones.
Tim, is that a service that you provide for anyone listening in that's looking to maybe get some consulting from you or would want some extra support where you could do analysis of like, hey, this is what we have, this is what we're interested in? Is that something that they could turn to you for help on?
Yeah, so just shameless plug, it is something that we do. So a big portion of what we do at Apogee for all sorts of customers is that the pro services, Mac readiness assessments, overall readiness assessments for Apple, the consulting, doing pro services consulting engagements around that. And then sometimes staying on. Sometimes we have a large enterprise customer that says, hey, can we get your ninjas or your SEAL Team 6 to come in and work with our team for about 3 to 4 months, transfer knowledge, modernize our environment, and leave? That's sometimes a question. And sometimes, and usually it's with medium-sized customers, they'll want us to stay on in a more protracted or MSP sort of model. So all of that, from assessments to doing the engineering work to being back of the house IT, is a component of what Apogee does.
I think that's great. I think, some of the things you both hit on too, on kind of like the why Jamf element of this, you hit it on like the being able to take an action quickly versus waiting. Sometimes some MDMs have a stall, and if you got to make a quick change, especially in healthcare and other high compliance industries, you don't want to wait, especially if you need to make a big change fast. Logs and policy confirmations, just making sure like, yes, something did actually take effect, and you don't always get that with cross-platform solutions. And you want to make sure like, did this update take place? Yes or no? Did it fail? Why did it fail? And you can investigate. Patching, yeah, all those good things that you listed off, Tim, I think are really great. Thank you for that. I think a few other things I want to touch on. So we talked a little bit about security at CrowdStrike, mitigating risk. I do want to change gears a little bit and talk about like Mac nursing carts. How is that going? Like, what's working well? What maybe still needs to be defined? I'd be curious about other areas where Mac is involved too, just kind of as we think about how Mac is maturing in healthcare.
Yeah, so I mean, the nursing carts with iMacs in particular, I was fortunate enough to work with a cart vendor that was open to hearing that we wanted to go with Apple products because it required a different mounting bracket, different device that required some engineering, but the guts of the cart. So it was interesting, this was about 1.5 years ago that all that dialogue started. It was interesting to listen to some of the cart vendors say, you're going to do what? You're going to put Macs on a cart, because they hadn't even thought of it at the time. But I think that the biggest thing was just working with a vendor to retrofit the mounting plate, cable management, that kind of stuff. But the carts with the Macs, I can't say it enough. I mean, they love the fact that those things last as long as they do, and that when they do plug it in and need to charge it up, that 20-minute charge is going to carry them way further than a 20-minute charge on the other devices. So. But it was basically inventing CAD designs and drawings with the vendor to try to retrofit those carts.
Yeah, Kat, and my 2 cents on that is the goal, the oasis in the desert is being able to walk up to a Mac cart, badge in, and have that experience be at parity with a Windows cart. And a lot of that is working today. There are still a few little things that are in the oven that are being worked on as we speak and being refined and tested. So I'm just being open with our audience here and folks that might be interested in doing this. that the Mac nursing carts, like Scott said, people are they're just raving fans of it, and a few of those final little technical steps are being refined now, and we're seeing more and more folks look at this model. And then to Scott's point, some of the manufacturers of the carts that make special brackets for the iMac or the Mac Mini, whatever you choose, those folks are producing them now, and those are available on the market. So it's totally a real thing, and something I would encourage others to at least start testing and getting. I think the most important thing is the user feedback. To Scott's point, IT being at the doing something for the user, and then listening to the user and saying, I really like this iMac on the cart. I'm a better nurse because of it. That's just so important, and would be a reason alone to work on something like that and give it a try.
I love this. I got maybe one or two more questions for you all that I have, but I did want to take a quick pause. Listeners, if you've got questions, put it in the Q&A box. This is your time just as much as it's ours. So if there's a burning question that you have for Tim or Scott, I'm going to say, like, with the 20 minutes that we have left, if you've got questions, they are more than happy to answer them to the best of their knowledge. If you want to ask anonymously, I think that might be an option too. Otherwise, feel free to start putting some questions in there while we round out the prepped questions that we have for today. So we want to make sure that we've got your questions getting answered too. So while you all are putting in some questions in the Q&A box, I did want to kind of hear a little bit more, because there's a unique, I would say, element to some of your experience. Some of the previous case studies that we've done at Jamf that are public facing, by the way, we've done a lot of healthcare here at Jamf. We have a team dedicated to healthcare. We've got resources here. We can't always kiss and tell. We can't talk about everything we do for like NDAs and things like that. But some of the public facing case studies we've done, UC San Diego Health comes to mind, Alberta Health comes to mind. But this one's different because I don't think I've seen anything like this in some of the projects we've done. You've done something with Epic and wall signs, and I really want our listeners to hear this because I think that is so unique. You obviously don't give away any info that you can't, but I'd be very curious, like, talk to me about these wall signs. Tell us all about these wall signs, because when you explained it to me the first, I was like, that's really cool. People need to know that this is possible.
Yeah, so I was fortunate enough to help with some of the beta testing with Epic. So they were doing digital signage. So the typical room number and, NPO status, any kind of cautionary flags that are outside the room, that is all digitized. So what we did is actually put that software with Epic on an iPad, and we dropped a cat cable in the wall and actually mounted the iPad into a sunken in flush wall mount magnet mount that's powered over Ethernet. So it's PoE for the technical folks out there. So you didn't have to run electrical to it, but it was powered over Ethernet. But it totally digitized all the signage in the hallway outside that patient room, with the patient name and all the stuff that you would want to see. So it was a cool experience to really take it to the next level, especially out there in the hallway.
I love it.
Yeah, I would say I had a chance to see that. And if you think about the old way, like some sort of clipboard inside of a chipped plastic holder on the back of the door, and hoping that information on paper is kept current and someone stops to flip through it and read it, and the new way, an iPad that's dynamically updated and crisp, clear, easy to view information, it's really pretty cool. So it just as someone that's not a clinician or doesn't round like Scott does, that someone that's had family members in the hospital, like that seemed like a game changer to me.
I loved it. You all had given me a nice sneak peek. One of the things I appreciated, like, it got rid of the paper clips first and foremost. That stood out to me. I was like, wow, how cool, like, not to have a bunch of folders and paper and things to shuffle. I have so many allergies. I'm allergic to so many meds. I noticed it had, like, you could customize it where it said, like, patient is allergic to. And I have had so many close calls on a personal note where people are like, oh, just give her penicillin. And they don't have time to shuffle through all the papers and be like, oh, she's allergic to all of these, right? Like, so as someone who's, like, got a lot of allergies, I was like, wow, like, that, like, could help really save someone and like not create bigger problems for someone who's already there. So I thought that was really, really neat. I've got a few final wrap-up questions, but I did see some questions float through the Q&A box, and I would love for our pal Ryan to join us. I would love to have us start addressing some of these questions that have floated on in from our listeners.
Yeah, hey everybody. We do have a couple questions in the chat. So first up, I would direct this to Scott about Epic Perimeter authentication. So how do you see Epic Perimeter authentication fitting into the future? That would enable orgs to enable BYOD Apple devices, offload device management, and hardware costs. So Scott, look at an MFA. You see that working with Epic?
You know, I mean, kudos to Epic, because Epic is closely aligned with the Apple technology team. So they're constantly talking about how they're going to make the product and experience better. But I think that does open the door for BYOD devices. I mean, Epic is an Epic Hyperspace for Mac. There's the ability to expose that instance outside your firewall through a DMZ. They could actually install it on their own device and access Epic directly. So I don't know if many organizations are doing that at this point. I elected personally to kind of stay on managed devices, but I do think it's going to open the door for the BYOD devices. And that's always controversial when you go from organization to organization. Are they going to let you set it up or use anything on that device that they're bringing to the table? So.
Yeah, I agree. Tim, that kind of opens up a bigger question for you too. BYO versus managed, in your experiences in the healthcare space, what have you seen more or less? What have you seen for answers to that debate?
Yeah, I think the answer is the vast majority has been a managed corporate provided device. I know I commented earlier on how we're seeing more iPhones that are being issued in a one-to-one way to the nurse. So the system may hire a nurse and say, here's your badge, welcome to the hospital, and here's your iPhone. And this is your tool that we're providing you to deliver care. And the systems that have done that have said that the NPS scores, like just nurse satisfaction around what technology at the hospital is providing to them, have gone through the roof. It's been 7, 8s, and 9s. So generally, we see for full-time employees of the hospital system that the system is providing them their device. I think there are always going to be edge cases. You may have traveling physicians. You may have, say, surgeons and other leaders that spend a little bit of time at, say, 4 or 5 different hospitals, and that may be more BYO. But generally, I would say in this space, and I was having a conversation years ago with someone once, and they said, be in a corporate environment, BYO is almost like telling someone when they join the Army they have to bring their own guns. And that really, the organization should look to provide a modern device that the person enjoys using within reason to that individual that they're bringing as part of their team. So those would be my comments there.
Ryan, I'll just add a little bit of context from the Jamf side too, of kind of what I see in healthcare and outside with bring your own device. First, very consistent with corporate managed devices. What I do see though is some light management and light security because of access. What do people have access to on their own devices? Do they have access to some sort of corporate communication? Do they have access to client patient data if they need to and they're being paged? I don't know how else to put it but no one really uses a pager, but you know what I'm saying. They're being called to help support. So I think it's a matter of if they're not in the network, they're not on site at the hospital, what do they have access to? And how is that sandboxed into that work profile? So that way things are still secure to avoid any sort of data, patient leaks, to remain compliant for HIPAA as well. So I've seen that be a bit of just some light management and light security just to maintain that integrity of that person's device that they own, but also what corporate information, patient information, do they have access potentially to? So.
Ken, I was going to add, I mean, with what you and Tim were talking about, I mean, just because for the folks out there in the audience, just because it's a managed device, don't assume that they're not going to want to use it, because, I rolled that out to pilot physicians and found myself running into them in the hallway months later, and they literally bear hug the device on the elevator, and they're like, hey, I'm like, hi. They're like, you're not taking this away from me, are you? And I'm like, no. But I mean, it's a managed corporate device, but I mean, I've never seen people bear hug a device that, like these MacBooks that, are giving them access to Epic and other systems locally and natively, that they just like using them. So,
Hey, Scott, if it's okay, it's a close segue here. I'm going to stick with you for our next question. When you deployed Macs, did you use Apple managed IDs? And if so, did you have any challenges?
we did not use Apple managed IDs, so that's a good question. And I know some of the Apple friends are out there. They're actually working on this dilemma right now, where, I mean, most of the Apple devices are not built to have hundreds of people logging in and out of them and the profiling of those users, but we use dummy accounts to get the OS up. And then once the OS was up, it was like in a locked kiosk mode, and then they logged into Epic and the various systems directly.
All right, we've got a couple more, so I'm gonna continue going on here. Let's see, next question is how challenging was getting Epic and healthcare IT to work together to get an application running natively on Apple versus, say, something like Citrix?
Yeah, I mean, Epic had been, there's various academic medical centers and large health systems that had been obviously asking Epic to find some solution to let their products run on an Apple device. But, it was great to partner with Epic and their development team. And really, it was a culmination of working with Epic and with Apple engineering to get it to the point where we could regression test it and test it locally and start deploying it to scale. So, yeah, I mean, it was one of those events where you're literally sitting there watching an Epic engineer and developer and an Apple engineer developer like writing code on the fly and changing it and say, try it now. So that was a cool experience for me as a tech guy.
Excellent. Tim, Kat, any of your experiences? I know we've come a long way in the partnerships across the entire healthcare space, working on either alongside Scott or in other hospital systems with Epic.
Yeah, I would say for the past 2 years at HIMSS, I mean, anyone that attends HIMSS knows that Epic has like a city block size booth there. And for the past 2 years, they've had a section of that dedicated to hyperspace on the Mac. So we see the commitment from Epic, and it's continued to mature and grow and get refined. So, and the number of sites that Epic has made hyperspace for the Mac available to has grown and grown and grown. It was, it started out maybe 5 or 6 health systems, and now it's a much bigger list. So I guess to answer the question, like how hard was it? It seemed like Epic was from our purview, at the table wanting to make this succeed and support it long term. So that would be my 2 cents there.
Yeah,
Okay.
I mean, I would say as far as challenges go, it's come a long way since Jamf has really been working to make things work, and you want things to work natively. That's the goal. Like I would say, using something like Citrix, if it's not running native, you want to find a way for it to run native. I guess what I'm trying to say here is a lot of people are like want to do a copy paste from the Windows side to the Apple side and use the Windows platform software on the Apple platform itself. And you'll find, and Tim, Scott, feel free to correct me if I'm wrong, but you'll find that it's not going to be an exact copy paste. There's going to be similar ways to do things. Like I think of encryption. How you encrypt on a Windows device can be very different how you encrypt on a Mac. And same thing when it comes to, using some of these applications, right? How it works natively on Windows is going to be a slightly different how it natively will be on Apple. So if it's built for the Windows platform, you're going to want to try to keep something like that there, but then use something like it, or work with, again, like the team described, with Epic to get it work natively, because you don't want to have other problems come from just trying to do an exact copy paste.
Yeah, no, and to piggyback onto what Tim was saying about just there seems to be a groundswell right now in the healthcare industry of people looking at Apple in a very different way in healthcare, and it's exciting because I think there's organizations that are dabbling in things that are going to take this to the next step. But I mean, I think what's the most promising thing is that the stuff that doesn't work natively, or these third-party applications that, people that are on this call that are buying those services from those third parties, they have the bartering power to really push those partnerships to, hey, make this available on a Mac and make it OS agnostic. And I think that is where, if you're looking at just a standard Epic experience, with Epic fully running secondary prescription authentication and PACS viewing, that's 80% of what most people do within Epic on a day-to-day basis. It's those TPIs, those third-party integration efforts for Epic on a Mac that they get squirrely. But I think it's working with partnerships to say, look, we're making an investment in these devices. We want you to make an investment in the code to make it work without having to push a user on a Mac through Citrix or something to go get to an application.
That I'll say to wrap up on that, and then Ryan, I'll hand it to you for other questions, is spot on. The hospital systems are issuing big purchase orders to vendors, and so they have the control and the loudest voice and the ability to say, hey, we want to, whether it's a security or something that's used in the clinical space, hey, we want to see at parity support for multiple operating systems, Mac OS included. So I think that's a big thing. And I think another big thing is not to get overwhelmed with this. Like we were talking with a customer the other day that has 100,000 Windows machines, and our guidance to them around the Mac in their environment was to say, hey, look at just the users that are using web browsers, browser apps, Microsoft Office, Teams, Outlook, Word, Excel, PowerPoint, and Epic Hyperspace. And start there, like build a center of excellence, deploy the Macs to those users, the users that would prefer a Mac. And out of 100,000 Windows machines, you'll probably at least get a couple thousand folks that'll say, yeah, I can easily take a Mac, work natively in the OS, and be a happy user. And through there, you'll build a foundation and some skills with your internal IT teams, and then you can grow it from there. So,
yeah, I've got one last question, and with 3 minutes left, we'll try to knock this one out, but it actually goes a lot deeper than where you just finished off, Tim. So we're asking about managing shared carts with a Mac, right? So managing multi-user on a Mac cart. We've got individuals out there, and specifically someone's been doing extensive testing with Imprivata. It's still a little clunky, are their notes, but authenticated guest mode is promising for the future with Imprivata. Still not ready for prime time. We're just wondering what kind of feedback or experiences anyone on the panel has around managing multi-user on a Mac cart. I know there's some other solutions out there too that we saw at WWDC. So I'm wondering if there's anything you can share about your experiences managing multi-user. Scott, let's start with you, and then we'll kind of go around the horn.
Yeah, I think that is where, again, I don't know the ins and outs of what Apple's doing, but I know that they're working to address this multi-user login aspect of healthcare, because you don't want, if a device on a nursing unit can have 70 or 80 users, you don't want to have to enroll. If you enroll every single user, it's got to create all the subfolders, et cetera. But Brian, thanks for bringing up the Imprivata folks. And if my Imprivata friends are out there, I want to shout out that is a good case study in how we brought a partnership to the table that, Imprivata actually went with me out to Apple Park, and we sat down and they conceptualized the tap and go product and actually developed it from scratch. So, there's partnerships out there with the right people that are willing to explore these. But again, nothing's perfect, and Rome wasn't built in a day, but I can tell you that, the multi-user aspect of it gets a little squirrely. That's where, before Imprivata even had the product available, I just told the team, we're just going to do kiosk level mode boot up. And then that way you're in the OS, and then they're going to touch ID into Epic directly. But that is one of the things that you got to address. But I feel like as the time goes by, that's going to get better and better in the healthcare setting.
Yeah, I would say absolutely. There are users that prefer the Mac so much, they're willing to just walk up to the Mac and manually log in with their username and password, with their credentials. So that's number one. Number two, even on the Apogee side, our engineers work pretty regularly on a regular basis with the Apple engineers and also the Imprivata engineers. So what I would say to the person that asked that question is that I can tell you directly, this is being worked on at multiple major sites throughout the US. Imprivata engineers coming on site, working with Apple and then internal IT at that system to get this stood up, tested, take feedback and fix it or make it better. So that's happening right now. And while there are other solutions in the marketplace, I think if we just put on our realist hat for the moment, Imprivata is in a lot of major systems. The card readers, everything is already deployed and being used there. And so those people are working to get the shared Mac thing better and better. So to the person asking the question, I would say, if you don't have access to those resources, we're happy to help at Apogee because other customers are doing that now.
With that, we are at time. So I just want to say, Scott, Tim, thank you so much for joining us today. Thank you for sharing your experience and being really leaders in the healthcare space when it comes to Apple and Jamf and really helping organizations maintain that security, maintain ease of deployment, and all the things that people seek. I'll just kind of round it out. If you want to leverage Tim and Scott and start conversations with them from a consulting perspective, a partnership perspective, please feel free to reach out. We'd be happy to get you all connected and help you all be successful. I think the goal is for today to recognize it can be done again and again. What they've achieved with their experience in many different settings can be done for you as well. If you want to test some things, a lot of people are like, hey, we want to, put a pilot together or a little testing ground. All these things can be achieved. So I just wanted to leave you with that. And it really starts with just starting a conversation. So feel free to reach out to our wonderful partners at Apogee, and we're all here to try to help you be successful. So thank you all for joining. Thank you for listening. Tim, Scott, and Ryan, thank you all so much for being here today. And we hope you all learned something new, and we'll catch you next time. Thank you.